Good boy. Yes, you are. My corgi, Ace, he's 17 months old. He loves to play soccer and ball. He likes to play too much. It's hard to keep him still. He was outside playing with my granddaughter, and she came in and she said, "Grandma, he yelped." And I said, "Well, what happened?" She said, "I don't know."
Hey.
Hi.
Hello, how you doing?
Fine, how are you?
What's up, Ace? What's going on here?
He's been limping on his left leg.
Oh, yeah, we sure are. How long have we been lame?
A month and a half, maybe.
Okay, let's get on the table and take a little look here.
Okay.
Now, did you notice anything happen?
He was outside playing ball, so I figured he just pulled something.
Yeah.
But it didn't get any better, so.
My hope was sprain, strain, but if it's been a month and a half, probably got a little something more serious going on. Can we stand up here a little bit, baby? All right. Gonna see what we got going here. It's called a tibial drawer test, trying to see if there's movement in that joint. And you see that?
Yeah. I
That's
see
not
it.
normal there. And we do have looseness in that joint.
Right.
So we definitely have a torn ACL. And not the most common thing for small dogs, but it can tear it. There's actually multiple strands that make up the ligament. Several strands will break, but the joint is still sound. Once that last one go, boom, and then the joint slips, and that's where you get the yelp, and then it's a complete tear. So, unfortunately, they have to have surgery.
Right.
To stabilize the joint. If we don't do the procedure to get this joint stable, then Ace is not going to use that leg anymore. He's going to hold it up and be walking on 3 legs, and we definitely don't want that. So we need to do surgery so we can get back sound on all 4 legs. We got a slot today if it's something we want to get done.
That's great, yes.
Okay.
Let's go ahead and do it.
All right.
Ace and my granddaughter love each other, so we'll have to do what we have to do to get him well so he can get back out and play like he likes to.
Come on, big
Say, we'll see you
boy.
later, mommy.
Bye.
Tell her bye.
Bye.
Hey, what up, man? I ain't got no treats. The worst kept secret in this hospital is that Andrea keeps treats near her station, and she feeds Bear, the office cat. And we all know Bear doesn't need any more treats. Andrea got you spoiled.
Andrea's still giving them treats.
Yes, she is.
Andrea,
Oh, y'all just let him go in there?
I thought we had a no treat thing right
He said,
here.
come here. Bring it here.
Hey,
Why are you teasing him?
they don't even make
He
no
didn't
sense.
even have no treats today. And then, check this out. This is,
For urinary health?
yes, it's healthy treat.
She's hiding others, though.
You know what, Michelle?
2 bags of treats.
Y'all just let him go in there and just, you know what? No teamwork.
You get up and do tricks if you get some food.
They better stop messing with you, I know.
You think the way Andrea cares for Bear, that he'd be hers instead of being the clinic's cat?
She might as well take care of Barry, especially with all the employees bringing their babies in.
Bring your pets to work, I think that's an amazing perk. It's definitely a better perk than getting to bring a scooter or getting free food.
Especially the one that you take advantage of with Coy and Ghost.
Hey, I guess Coy and Ghost happy to see me too. Well, I gotta go back to work. Why you don't ever bring any of your babies in?
Few too many treats.
That's future treats.
Yeah.
Okay, I'm sorry.
A ball python named Diesel arrives, exhausted.
Diesel. He's a big boy. He's about 5.5 foot long. So his name fits because when I think of a Diesel, I think of a Big Mack truck. On a good day, he loves to be held. He likes to explore, but we're concerned today.
Hey, what's up?
Hi.
How are you? How long y'all had Diesel?
About 3 months. I'm a first-time reptile owner.
Okay.
He was completely fine, but the last week, he's not really been himself. He's not moving around a lot. He won't sleep in his hide, and I can see him breathing.
How is his habitat?
His tank normally stays anywhere between 70 and 90 degrees, and he has a wooden stump for his hide.
Okay. Have you noticed him keeping his mouth open a little more?
A little more than usual.
When was the last time you ate something?
Friday. He did eat Friday.
Okay. No, buddy. See some bubbles. Don't like those. He has some fluid in the back of the throat. I feel like he has an upper respiratory infection.
Okay.
I just want to make sure we don't have any kind of pneumonia or anything.
Okay.
I'll be back, okay?
Okay.
I definitely want to take a look at x-rays and take a look at the lungs. Pneumonia is really bad for a snake. It can oftentimes be fatal.
We get him in 3 sections.
You ever seen a snake x-ray?
No.
This stuff here definitely tell me he's eating because that's poop.
you go.
This is the lungs.
Okay.
Air shows up black, which is what I want, but getting a little cloudy here, which I don't like. We're starting to get a little pneumonia. I think I'm gonna nebulize him a little bit and then show you how to give antibiotics.
Okay.
All right, we'll come get you in a minute.
Okay.
I want to make sure that we don't get worse. Hopefully this nebulizer treatment breaks everything up, allows it to breathe a little bit better, and then give him some antibiotics, and hopefully he feels better.
Okay. Hey.
All right. What I want you to do is break this up into thirds. First third, the middle third, and the last third.
Okay.
Okay, last third is where you want to get a shot.
Okay.
Go into the muscle, feel right there.
Uh-huh.
And then you're going in between the scale and inject. And you're gonna have to do that every third day for me.
Thank you. I'm just hoping for Diesel to get back to his normal self for my daughter's sake, because it's her snake and she is in love with him. Come on now. It's okay. There we go.
Dr. Silva assists Dr. Ferguson, completing Ace's ACL surgery.
What's the best thing about ACL jokes?
ACL joints?
ACL jokes.
What is the best thing about ACL jokes?
They're very funny.
Funny. She's so good, Jordan.
He is.
Throwing me off, but that was great. I love that one. It's a funny. All right, Doc, ACL is complete.
Thank you, Doc.
Good job, Doc.
Cool. Ace is knee is stable. Doc did a fantastic job. She's a great surgeon. She even had good dad jokes, and I'm so proud of that, too. Now they're getting a bandage put on. Once we wake up from surgery, we'll discharge this afternoon. Hey, hey.
Hi,
How you doing? Everything went well.
Great.
We got that leg stabilized. We have a bandage on. We have some medication going home, an anti-inflammatory, pain meds, and we have some antibiotics, okay?
Okay.
So once the bandage is off, we'll take those staples out.
Okay.
We're not gonna start any therapy until those staples come out.
Okay.
Therapy is pretty simple. What we're gonna do is start walking circles with the bad leg on the inside. And we'll start about 5-minute sessions twice a day, and we'll work up till we get to about 20 minutes, hopefully 3 months, and we're ready to roll.
I hope so, too.
Yeah. It's gonna be a long process, maybe 3 to 6 months, but I have no doubt that Ace will be back up and ready to go in a few months. Everything good, we'll get your baby.
All right.
All right, thank you.
Appreciate it.
Yes, ma'am.
Thank you.
All right, have a good one, okay?
You too, thank
yes,
you.
Yes, ma'am.
Now it's just recovery time and no playtime. It's like sticking a kid in the corner. Love the bandage, dude.
Yes.
I'm hoping his healing will be fast, and in a couple of months, he'll be able to do what he wants to do. I'm ready if you're ready.
Yeah.
I'm just thankful that I could come over here and get the surgery done. Thank you. He's so heavy.
Hold on, Betty. Hold on. It's okay.
Animal rehabber Nicole returns to Critter Fixer with a staggering new patient.
Draco is a wild wolf that was brought to me, and he is dragging his back legs, falling down all the time. You can do it. My hope is that we can give him a better quality of life and make sure that he's not in pain. Hey, it's all right. Hey.
Hello.
Stay back a minute so I can tell you a little bit about him.
Okay.
He's a purebred wolf. He reacts out of fear. This is the first time we're taking him into the vet's office.
Okay. I've seen a few wolves, but not a black wolf, and definitely not in the clinic. So not sure what to expect today. Hopefully this baby is nice and not too aggressive, and we can get done what we need to get done. How long you had him?
I've had him for about 2 months. They found him in the wild. But at one point, he was definitely domesticated. And then people must have let it loose. Humane Society took him in. They were going to put him down because he couldn't stand or walk.
No wounds or abrasions that look like?
Nothing. But I got him standing, got him walking. I have him in like a 30 by 50 pin. So he can get up and walk straight lines. But when he goes to turn, his hips drop. I mean, he gets knocked over with the wind.
Does he ever yelp?
No, but, you know, wolves are very stoic.
He just acts weak.
Yeah.
All right, so first thing, we need to try to go outside. I need to see the baby move, right?
Yeah.
Okay. I'll meet y'all in the
Outside.
back. Level of concern is pretty poor right now, to be honest, because this baby has to be able to get around and be mobile to have a normal life.
Come on, Draco.
Well, he's real weak in that back end, ain't he? He has no problem urinating and defecating?
Nope.
He wants to run,
Yeah, he wants to run.
but that back end kind of swish around.
He's got the will to live.
Draco is very weak in the back end without some assistance. At this point, I'm not sure if it's something neurological going on. We're gonna have to give a little anesthesia so that we can take some x-rays to try to get a diagnosis.
Okay.
Let's go pull up something to give him.
All right.
Hopefully it's not something neurological because it won't be good as far as prognosis is concerned. If it's something with hip dysplasia, there are some things that we can do to try to help.
Okay.
But we just have to figure out what is causing that weakness. Give me like a full spine all the way up to the shoulders.
Okay.
Uh-oh. Hey, Doc.
Uh-oh.
Where's the bullet?
Wow.
They got shot.
Mighty close to the spine, isn't it?
Yes. That's not good. Pretty close to being in the spine. Because the spine this way. We'll look at it 90 degrees. Yeah. He did get shot, but it's a pellet gun. It wasn't like a rifle. We can see here where it's a little projectile, and it is in the area of the spinal cord. There is a possibility that this thing is causing some issues, but I don't really know that's what causing the weakness in the hind end. I would think if that was causing a problem, then we would have other problems. But we look at the x-rays here, trying to look and see how well these balls fit in the joint there. It doesn't fit all the way in on this one here, and this one is even less. Now, I'm checking the joint laxity, where I'm pressing down on the hips, and I'm rotating in a certain fashion to see, so I get a clicking of the hip, and it clicks in both of them. The ball is a little bit irregular here, so we do have hip dysplasia. Those hips are bad. Whether we can regain function in that hind end is really going to determine the survival of this wolf. We do have hip dysplasia.
Okay.
Have I seen worse? Yeah. But Draco was shot. It was like a pellet gun.
He was shot.
Yes. Now, the pellet is right at the spine area.
Really?
But removing the pellet in this case would not be good. Going around the spinal cord trying to remove an object may cause more harm than good. It's not definitely in the spinal cord. We know because we wouldn't be doing anything. It could be so close that it causes inflammation or swelling that's pressing on the spinal cord.
Right,
So if we can help with the inflammation, it subsides, it comes off the spinal cord, we may regain some function.
It's very overwhelming that Draco was shot. It's not something everybody sees every day.
The only option that we have right now is to go on pain anti-inflammatory medication. Hip-wise, dysplasia-wise, we want to relieve inflammation there too. It's not going to make the dysplasia go away, but it'll help us be more mobile.
Quality of life. Where is his pain scale?
I don't think he's in a lot of pain. I think he's just weak and uncomfortable. That's why we're going to put him on some anti-inflammatory pain medication, and I think we at least have a chance here.
Okay.
We're going to give an injection to start us today, okay?
Okay.
In this case, we have to treat what we know we see. We know we have hip dysplasia, so we're going to treat that with our anti-inflammatory pain medication. But also will help in the area where the pellet is. When we get this inflammation to subside, then we'll regain function in his hind end also.
Am I going to be giving him injections?
Nope, you're going to be giving pills.
Okay, cool.
Okay, all right.
Thanks. Dr. Ferguson has given us hope that we have a chance. The medication hopefully is going to reduce inflammation and some of the symptoms will go away.
We got you, Bubs.
Good job.
You know Cletus?
No.
This is Cletus, my newest pet. His sweetest pie. Say hey, Cletus. Dr. Hyder, come here.
Oh, no.
Have you met Cletus?
Oh, no. Hi, Cletus. What's wrong with Cletus?
Cletus is mine.
Oh, he's the new one up front.
Yes. It's pretty cute, huh?
He is cute.
He looked like a Cletus, though.
I think so.
Cletus super fast.
Where'd you pick him up?
He was a rescue, and they were like, what we gonna do when we can't sell him? So I was like, I'll take him.
Nice.
Because you couldn't have got a better home, could you?
Right?
Good morning. Wanna go potty? I recently acquired Wilbur from a family friend. Hello, Wilbur. I did originally think that Wilbur was a boy, but after spending some close time with Wilbur, it turns out she is a girl.
Said you was out here with a pig.
I thought it was Bring Your Pet to Work Day.
So you brought a pig?
Yeah, her name is Wilbur. Like the pig off the movie? Yeah, but it's a girl.
How did you think that was a boy?
Well, it came with the name Wilbur.
And let me guess. There's something wrong with it, right?
Lucky guess, there is something wrong with that. She's got some extra friends.
I see. It's like you got some lice.
Yeah.
Lice can cause a lot of itching and discomfort, scratching. You can see the hair loss.
I gave her a bath and it got some of them off.
Yeah. Give me some medicine. I'm gonna get rid of these lice for you.
All right.
One of the big benefits of working here, obviously, is that I know Dr. Hodges will always help me with all of my animals. First, you got to be Wilbur's friend.
Oh, we're gonna be friends. Hey, calm down.
Everybody knows that pigs' way of life is food.
Hey.
And Wilbur loves cookies.
Hey! Wilbur, these hands are very, very, very important.
Wilbur was very, very excited, and Dr. Hodges almost lost a finger today.
All right, Wilbur.
All done.
I still got my finger, even though Wilbur tried to take a couple of them. But those lice should be dead, and we should be good to go.
She is upset with you. Let's go get some food. Come on.
Hey,
What you got?
got a dog's been in labor since like 10 last night.
The fact that it's been over 12 hours concerns me.
I'm heavily concerned because this is my dog, Brienne's first litter, and I was up all night with her. No puppies were coming, and hours went by, and I said, this is not right.
All right, go ahead and give me an x-ray right quick. Let me see what I got.
All right.
I don't want to lose my baby. I know that things like that happen. I'm concerned about the puppies, too.
All right. A lot of babies in here. Some big puppies, too. One in the cervix. I hope that one's okay. We need to get these puppies out here fast. Anytime you see one that could be in the cervix, you always worry if that puppy's still alive. So let's get to surgery.
All right, you ready, girl? Yes. Okay. There you go. We gonna make you feel better. Yes.
What you got, bro? C-section look like?
Yeah, she got a lot of babies. One coming up in the cervix. I'm hoping that one's okay. So,
Okay. Well, I'll jump on this side.
Okay.
Fight on the back side.
That'll work.
Y'all ready? Mm-hmm. When C-sections come in, it's always all hands on deck.
When a puppy's trapped in the cervix, it's highly likely that this puppy is suffocating and could possibly die. But it's also blocking the other puppies from getting out.
Which is why it's important to get them out as quick as possible so the other babies aren't deprived of oxygen for too long.
All right, Dr. Hodges.
Come up.
How many puppies?
I didn't count them, but there's a whole bunch of them.
All right.
Typically, you don't see C-sections in bigger dogs like this. However, this dog has some big old puppies, and it's kind of like a train. And then the engine gets stuck and can't move. The rest of the train gets stuck on the track.
Got warm towels?
We got a box.
How we sound?
Sounding good.
All right, ready to go to work?
Yep, go right ahead. I got you.
All right.
Get ready.
All of the puppies should be enclosed in their individual sacks within the uterus, which I'm beginning to remove. Now, I know this is your first C-section with us, Asia. Please listen to Jordan.
Don't touch his glove. He's gonna drop it in your hands, and you just got to catch it.
Here's a big puppy.
Big puppies.
All right, want to hear him do a little breathing, make a little noise. Okay. Make sure that no fluid in the mouth, just kind of dry it out a little bit. Keep drying him up there.
The next one come out. I'm gonna send the problem child to you.
Not this one.
Not that one.
All right.
This next one is out of the sack. I get that one to Ferguson ASAP.
That one don't look too good.
Whew, yeah, he's bad. Yeah. Now the green meconium shouldn't be there. The sac had already opened up. Meconium staining is actually a result of the first poop that the pups pass in utero. If it's aspirated and we don't get the nasal passage clean out in time, it can develop into pneumonia, which is why we need to clean those nostrils out as quick as we can. This was the one that was stuck in the canal.
Hey, T, this run ain't looking so good either. Coming your way.
All right, I got one in my hand. Trying to get these lungs open up so we can get some breathing going on. Come on, though. We're trying to just get some vitals, if anything, going here. This one right here ain't getting anything.
Come on.
There's another one.
T, talk to him. I ain't hearing a lot of crying, boss.
This is the baby I'm worried about. This baby came out just green in the sacs. Right now, I don't have any breathing, heart rate, or anything. Hope we can bring this baby back.
Just make sure they get warm.
Right, one more.
Make sure the mouth is cleaned out here. There's no fluid there.
Another one.
Where's Drea now? We're gonna need some more hands here.
Andrea.
Oh, wow.
A lot of babies.
Yeah.
You got another one.
Keep working, keep working, keep working.
I'm working on mine. Getting to get another one.
You got one more coming.
Come on, buddy.
Come on. Oh, I'm getting so much out of this puppy. It's ridiculous.
Come on, you can do it.
Keep trying.
Okay, this one's trying right here. It gave me a little something. There you go.
Here's some crying.
Oh, that one made it? The green one?
Yeah.
Oh, wow.
We got that baby pulled through, and we're breathing and we're doing well.
I like that.
Oh, you good. You are cute.
You got any respiration going there?
That one, crying a little bit.
Made a little noise. All right, put it over here. Go. Everybody going but one right now. We're still working on this one.
The small runt is the one we have some issues with.
Yeah.
There's another one.
No, thanks.
Happy. Oh, thank you.
We need more hands over here. We got more puppies in
Talk
hand.
to me, T-Flea.
We got everybody except that little small one that came out. We don't get anything.
You got another one?
Okay, that one going. Let me get.
Kayla, that's it.
All right.
Mama hanging in there?
Yeah, mama good.
How we looking at there?
We had 10 total, 9 going.
9 going.
We couldn't get it back going.
Okay.
We never want to lose any puppies, but we have 9 pups, and that really makes me feel good that there'll be 9 new babies in this world.
He moved.
Oh, yeah, look at it all.
I'm putting my final staples in. We're good here.
There you go.
It's always great when you have a good outcome. I mean, these kind of cases, you don't ever know.
Hey, Mama. Hey, baby. Don't latch on up. I know. They're all kinds of colors. So cute. It's emotional seeing the puppies, the joy and the beauty. I mean, it's just so amazing. Come on, open your mouth, Date. I did not know them puppies were in there. I knew they were in there, but I mean, whew, there's so many of them, and they're big to be brand new. I'm so excited. Oh, yes. Girl, you got
We're gonna let you bond with them.
Thanks. I'm so thankful.
Trey is very nosy. I got Trey, he's my red ear slider turtle. Pretty spur of the moment. It was at a fair. I thought he was cute.
Trey is extremely nosy. Whenever you come into the room, he'll drop what he's doing, peek his head up and like give you a little side eye. We just need to get him a yearly checkup.
Trey Day. What up, y'all?
Hello, Dr. Hodges.
How you doing?
How long y'all had this turtle?
7 years.
And we wanted to make sure that he's healthy.
Okay. Hey, bud. What are you feeding him?
Crickets and
The pellets.
like little vegetable pellets.
Okay. Have you noticed? I just want to see it. This is not a normal turtle shell. This looks like a case of shell rot. Yeah. Give me 1 second, okay?
Okay.
Polly, can we clean it with betadine?
Okay.
Trey is presenting with scaling shell, where the shell is starting to break down and gotten infected. A lot of times this will occur with the water, sometimes too much nitrate, sometimes bacteria get in the shell and it just become unhealthy.
Right here on our scoops, we got a lot of shedding going on. We see shedding, but this one is excessive. So I'm just gonna clean that up and get them nice and fresh.
Do you have a picture of the tank? I just want to see the water. How often do you change the water?
The past 20 months, I was by myself.
Uh-oh.
I didn't do a great job of it.
Yeah, okay. So now, okay, I got it. I actually have my own pet turtle. I get it. But I do think the water quality plays a factor in it. The stagnant water and the bacteria and all those things that get in there and cause that problem.
Okay, so like change his food like every week or something?
I would. If left untreated, this could definitely get worse. Shell rot in a turtle is very serious. It can lead to septicemia, which is basically the bacteria getting within the blood, and could cause some real serious disease. And you can get like a cheap water kit and check for nitrites in it.
Okay.
I'm gonna show you how to put this cream on there, and I think you'll be fine. All right.
Okay.
We honestly didn't know about shell rot. He would have scales fall off, and we just thought it was him growing. So we thought he was healthy.
I really want you to get down in there with that.
Okay.
Yep, just all of it. You want her to... Oh, you're a pro at this.
It's my son. I gotta make sure he good.
I got you. The Silvadene cream gonna get in there, and hopefully we get rid of secondary infection. This shell gets back normal, and we do just fine.
Also, what about nail trimmings?
I noticed they were long.
Yeah, and they scratch, yeah.
All right, we'll cut them for you.
Be careful. He never got his nail trimmed before.
Oh, he's trying to bite now.
I ain't never seen him act like that.
I've seen him like that.
That's why I'm putting that in. Kind of protect. Oh, yeah, you see how he wants to bite? So that kind of protects Paul.
Is he okay?
Oh, yeah, it's fine. It's like a dog or cat. It doesn't hurt at all. That's one thing about veterinary medicine. I didn't know Trey was gonna react like that. However, you gotta always expect the unexpected. So I definitely want to make sure I protected Paul.
Oh, just once a day? Mm-hmm. Okay.
I think in a few weeks, Trey should be just fine.
Okay.
Sounds good.
I'm glad we were able to find someone who's able to take care of Trey and figure out what's going on with him. I just want him to live a good life, a long life.
See y'all later.
Thank y'all.
All right, see you later.
Who you think heavier? Look at it. He like a small kangaroo.
Dre, he looks like a baby bear.
Come on, Bear.
Bear weighs less.
Michaela, come tell me how much Bear weighs.
14.7.
What do you think he weighs?
18 pounds.
What does that say?
I don't believe it.
Oh, wait, that rabbit is 8.8 pounds.
They're gonna try to take care of you, okay?
My man. Hello. Tell me about this kitty cat.
This is Roman.
Roman.
He's a little stray boy.
All right, where we find Roman at?
Roaming around.
Roaming around, I like it.
Roman's a stray cat that's been hanging around our house for about
5-6 years now, and we've been trying our best to take care of him. We've been feeding him, and then recently he wasn't looking so great, so we actually were able to catch him for the first time and get him to a vet. He is positive for FIV. We're basically owners of him at this point, so we want to get care for him. We are not ready to see him go.
I see why you fell for him. He's super sweet.
He's sweet, he's a pretty cat, but he's not a well cat.
Yeah. You see how that skin turtle kind of stands up? They tell me he's pretty dehydrated. Roman did have an infection in the eye. We got some infection in those ears. His teeth aren't very bad. But the one thing we want to do is check his feline leukemia AIDS status.
He does have FIV.
If he has AIDS and leukemia, that's going to make it tougher. But if he don't, we may be able to bring Roman back to good health. So we're going to keep our fingers crossed. Feline leukemia and feline AIDS are very common viral diseases found most often in outside cats. Unfortunately, they are not curable. They compromise the immune system and sometimes can lead to death. I guess the big thing now, let's get him some fluids, clean up his eyes and ears, see what his white count looks like, and make sure we don't have no parasites too. Well, let's see if we can make him better. We'll be right back, okay?
All right.
Come on, Roman.
I'm not hopeful of a clean bill of health, but would love to be able to see him healthy again.
Definitely lost that eye traumatic.
At least, like, healthy enough to live.
Roman, we're finna get you some fluids there, buddy, bro. Roman does look rough, and he has some underlying issues, but instead of being the underdog, maybe this is the undercat. You want to root for the undercat, so I'm definitely rooting for Roman. Got some blood on Roman. Starting our fluids. Paul's gonna see exactly what my buddy blood looks like, and we'll go from there.
All right, Mr. Roman.
All right, Roman. Little dewormer for you there, buddy. Oh, you ain't like that, huh?
Who you got here?
This is Roman.
What's wrong?
He's a little dehydrated, and I want to see what his white count looks like.
All right, well, got him going on the fluids. Maybe he'll feel better.
I got some blood work for you to look at, Doc.
Roman, very rarely do you see the cat look worse than the blood work, but hey, don't look so sad. Blood work ain't too terribly bad. I'm really pleased with Roman's white blood cell count. It's within normal parameters. Even though he has feline AIDS, I'm feeling good that Roman can fight off this eye and ear infection. His blood work wasn't bad, man, to be honest.
That's good.
Feline leukemia, test is negative. I've cleaned his ears, got some meds. I've cleaned his eye.
Oh, it's looking much better.
But treated for parasites. He's just super duper dehydrated. Just to keep him on his fluid rate, get him hydrated, and probably need about 24 hours.
So y'all gonna hold him here then?
Yeah.
Okay.
Let him chill out for the night. Yeah, hopefully he'll be feeling better in the morning.
Thank you for trying.
No problem, man.
You be good, okay? They're gonna try to take care of you, okay? I'm happy for him. I'm glad he's getting the proper care that he needs. And I guess we'll see how he is tomorrow.
Hopefully he'll be feeling better in the morning.
Oh, no, you don't. Get his head, baby.
Diesel's owners are back, concerned their snake is not back up to speed.
Hey,
Hey,
what's going on?
I gave him 3 doses of the antibiotic, but he just genuinely acts like he doesn't feel well.
Okay.
It's my daughter's snake, and if something happens to the snake, she's gonna have a fit.
Sound way better.
Okay. I just wanted to make sure.
It's all good. That's why I'm here. Before we had bubbles back there,
Okay.
but they don't look bad at all. No bubbles.
Maybe he's just being stubborn.
Yeah, let's just go look, just to make sure. I'll be right back.
Okay.
I just want to take an x-ray just to make sure that Diesel is totally fine. I don't see any cloudiness inside the lungs. That's what we want.
You can actually see his lungs. He was moving pretty good, so I'm pretty sure he's fine.
All right, that looks great. You know, that's what we want to see. These lungs, I mean, they clear.
Okay.
That's what we want. You did a good job at home. High five. You are good here. We good to go? So, I would love that. You got your phone?
I got it right here.
I'm very excited that Diesel's better. He's sweet, and I love him because of who he is.
Yay.
Fantastic.
Oh, thank you.
Thank you.
Bear just came in and just fell over. Hey. Oh, you want to wear glasses?
I'm pretty. I'm so pretty.
You saw she walked in here and just fell down, just like.
Lazy.
Say what now, Jordan?
Nothing.
Well, how do you hear that? Don't send that around mama. Look protective, I see, huh?
What they say to my baby? Ariana, what did they say to him?
Nothing bad.
He was just being lazy.
I let her wear my glasses, and I was not friendly with her.
He was, yeah.
Very distinguished, glasses
Yeah.
and the sweater.
I like it. I like it. It's very gentlemanlike.
Did he give you some treats?
Surgery tech Paul brings in his own critters for fixing.
All right, Doc.
So these the fish you've been telling me about?
Yeah, it's a couple babies. Got a few masks on them. I've had these fish going on about 2 years. I actually rescued them from a pond. They have tumors.
Oh, boy.
And one in particular has grown within the last 2 weeks. It's like doubled in size.
Oh, yeah. It's a pretty big mess.
Goldfish are special to me because when you've had them as long as I've had them and you watch them, they actually all have like little personalities. They recognize me when I come to them. They know when it's time to eat. So it's concerning. I got another one down there that has one similar to that, but he also has one on his lip.
Wow. Yeah, these guys are notorious for getting neurofibromas, tumors of the nerve sheaths. It's a fast-growing cell, and these cells just proliferate and cause some major problems.
He has one almost in the exact same spot.
Oftentimes it's congenital, which means it's kind of a genetic thing.
I was gonna ask you that because all these fish, I believe, are siblings or something, and they all have these masses on them.
Get them ready for surgery. When you do surgery on fish, it's just a little bit different from doing surgery on terrestrial animals. You can't intubate them or inject anesthesia. So we put anesthesia inside the water. The fish gills, gets the anesthesia in, and then it just kind of goes to sleep, just like a person.
Guess we'll start with the big one. We've done quite a few fish surgeries. Surgery, there's always a risk, but it's a whole different ballgame when it's your own fish.
All right, fish, look like you're going to sleep. Let's go down a little bit.
Okay.
I'm gonna use my electrosurgical tool on this. I have a foot pedal. What this does is, as I cut, it actually cauterizes at the same time. Paul is taking water, he's going across the gills to keep it breathing. I am starting my surgical incision. It's a big tumor, boy.
Yeah.
It's attached to his whole back. This is pretty bad. Just like with a human, it's very, very uncomfortable. If you imagine trying to walk around with a brick on your back, hopefully we get this thing off pretty easy and we don't lose a lot of blood. All right, 1 down, 3 to go. Waiting this fish up.
The most nerve-wracking part is definitely watching the fish recover because with a dog and a cat, you can monitor different things, but with the fish, all you can do is look at their reflexes and pray.
Come on, fishy fish. Some good old oxygenated water. Come on, fishy fish. Yeah. Paula, you want to put my next one in?
This is the one I'm worried about. This fish has a tumor on its mouth, and I'm thinking it's starting to have some issues with eating.
I'm gonna try to hand cut around his mouth. Ready for surgery. Come on, Wood. Come on there. All right, Polly.
You good?
Yep. Now, let's get this tumor off his back.
All right.
Whoa, 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 whoa. Oh, we got a bleeder there, Polly.
Oh, man.
A fish this small cannot lose a lot of blood.
No.
It's tricky here, buddy.
Don't look too good.
Oh, stop bleeding. Dr. Cook, got a bleeder.
That don't look good, Doc.
I don't.
Cauterize it.
Yeah. Dr. Cook is a first-year veterinarian here at Critter Fixer. She ain't seen a lot of fish surgeries, so it's important that we show her some new things. Come on now. Cauterize a little bit more.
Stop the bleeding.
All right. Come on. Got it.
Okay.
You know what? You saw how much blood was losing?
Mm-hmm.
Recovery tank.
Yep. Thankfully, the surgery went great. I was able to stop the bleed. We're gonna move this fish over to recover, and we'll start on another one.
Next, take a look at this one. But what I'm worried about with him, see his gills?
Yeah. You got some trauma there.
Yeah. I found a cat in my backyard the other day, and I can tell he had been swiping in the water because he was wet and it was dry outside. So I know he had been trying to play into the pond.
All right. Dr. Cook, did you know I have an undergraduate degree in fisheries biology?
Wow, I did not know that.
He has an open wound, so I'm just gonna cauterize it. Go on. And look, good to go.
Do you think having half a gill might take him longer to recover?
As long as the gill is functioning, you should be fine.
Right.
One last one, Polly.
Yep. Now this one, I think maybe the cat got to him too.
Oh, I don't really see much on that one. There's no tumor.
It looks good.
All right. The fish are on their road to recovery. I'm very relieved, especially since I have to see this particular client every day. We got 4 healthy fish, buddy. We'll get them recovered, then I'm gonna give them an antibiotic injection.
All right. It's definitely a good feeling. All surgeries are a win for us, and it's a bonus when it's your own pet. Appreciate you, Doc.
Proud. Hey, let's grab you out of here. Polly, let's check Roman out, buddy.
Okay.
Following an overnight stay for extreme dehydration, Dr. Hodges checks if Roman's thirst is quenched.
Hey, Roman, how you feeling today? Your eyeball a little bit better. Got his eye medicine. But skin turk is still not quite what I want. So, we're gonna keep Roman one more day, Polly.
Okay.
Get you good and hydrated, and you're good to go. How about that, Roman? Can you give me some of Bear treats? And get Roman a couple treats, because Bear don't eat his treat. When you got animals that look like they may not have had the best life in the world, especially living outside, they get to come in and get some TLC. You know, it's always good.
He wants some treats.
Okay, ain't like Bear. Is it a cat thing? Okay, there, Roman, there, Roman, there you go. Okay, well, not too much. One more. All right, that's it, bud. That's it. No, that's it. No more treats for now. Polly, you can put Roman up. Look like Roman has caught bare feet looking for treats. You just do everything you can as a veterinarian. You know, you kind of throw the kitchen sink at them, and hopefully they improve and get better, and they start having a good quality of life. And just looking at Roman, just a good feeling to see him come around. One more treat. Hey, you can't. Roman.
Okay. My dog, Jin, she's a puppy. She's just so lovable and playful. She will get into stuff. If you leave something on the floor, she'll definitely pick it up with her mouth. She started throwing up a few days ago and has been throwing up most of her meals since. So we brought her in today.
Hello, hello, hello.
Hello.
How are you? Hello, baby. What's going on here?
Last week, we think she ate a foreign object filled with foam.
Okay.
She was playing with it. My son couldn't get it out of her mouth. He tried giving her a treat to get her to drop it, and then he couldn't find it.
So good possibility.
Yes, and then on Saturday, she started throwing up everything she ate. She's still using the bathroom.
Okay. You haven't seen anything in the stew that looks abnormal, like we chewed it or we broke it up or anything like that?
I don't think so.
All right, we're gonna take an x-ray, and then we go from there.
Yeah. Come on, Jan. You're gonna go that way. You're gonna go with me.
Yeah, there we go. Worst case scenario is where we do have a blockage in the intestinal tract area, and we have to surgically go in and remove it.
Easy.
Best case scenario is that they may have eaten it, but it's already passed it.
All right.
All right. You see this grainy looking area right here? That's stool. And we can see it going here all the way back out like we probably got to go to the bathroom now.
Okay.
If something blocking something, it's not a total blockage because we're getting food through there. It doesn't indicate not a blockage either. It's still a possibility that the object could still be in the stomach. So I think I want to do a barium series. Where we actually give a dye, and we take x-rays in a series, and we watch the dye as it flows to the intestinal tract.
Okay.
So leave the baby with us this evening. We're going to give this barium. We'll take x-ray this evening, another in the morning, and then we compare all of them. And that tells us whether yay or nay we have a blockage, we need to go in.
I'm concerned that we haven't been able to find the object and that it might be in her and she'll have to have some surgery.
Make the magic potion now.
Hopefully we don't get that news tomorrow.
If this barium passed through normally, tell me that there's not a blockage there.
That's the good stuff.
Fingers crossed, the barium passed through. How you doing? Come on back.
Okay.
Let's look at some x-rays here.
Okay.
You know, yesterday we gave some barium that will show up on the x-ray white.
Yes.
Okay. This is a few hours after giving the barium.
Oh.
What we want to happen is we want the barium to flow through the intestinal tract.
Okay.
We took another one this morning. Now it has moved, and we can see here it's going through and heading out the back through the intestinal tract.
Okay.
Fantastic. It's moving.
Okay.
So there's no blockage, okay? So my thinking now is if there was something in there, it already went through.
Okay.
Or it didn't get it to start with.
Good. Really good news that they didn't find anything obstructing, so I'm just grateful that I don't have to worry about the what ifs.
We got a couple things going with you, okay?
Okay.
We're gonna send home something for nausea. here.
Yep.
A GI antibiotic. And I'm sending a bland diet home with you that we were feeding here that I want you to feed for the next few days.
Okay.
All right, we'll get your baby out for you.
Okay.
All right,
Sounds
thank
good.
you.
Thank you.
Yes, ma'am.
I'm so excited for Jen to come home.
Come on, sweetie.
We had a great experience here, but I kind of hope we don't have to come back until annual exams.
All right. Oh, she's happy to see mommy.
Oh, you are happy.
Let me know how everything goes, okay? If you need us, holler at us.
I will. Thank
All right,
you
thank
so
you.
much.
Yes, ma'am.
Roman, he wants some more treat. Here's a couple.
All right, now don't be like Drea now.
Oh, no, that's it, bud.
Roman is enjoying room service after a second day of recovery at Hotel Hodges.
Come on out of there, buddy. Roman is doing really good. In fact, Roman is doing so well, I feel pretty comfortable with sending Roman home today. Sweet kitty, huh? And you purring. Hey. Oh. It's only been a couple days, but it's gonna be kind of bittersweet to see Roman go.
When you treat that, I might as well give him one. I ain't never gave him a treat.
Roman has become quite the fan favorite around here. Hey, Ari, come here. Hey, I need the whole clinic over here right now.
What did you do, Ariana?
Not me.
Yeah, who said it? You know in his mumble voice, I ain't never gave him a treat. Let me give him one.
You can't keep nothing between us.
Roman's definitely a special cat. I mean, he has such a good temperament. He even got Paul to come up and give him some treats. Maybe me and Paul are turning into Andrea the way she gives treats to Bear. Hey, man.
Hey.
This cat has stolen everybody's heart back there. I'm being honest. He's doing great. His hydration is good. He's eating up a storm. He loves.
He likes you.
I don't know if it's me or if it's these. Hey.
Come here, buddy.
Here you go. There you go. Hey, there it is. We have some eye ointment here for Roman. Definitely make sure you give him plenty of fresh water. As you can see, he is feeling so much better.
His energy's definitely up. Roman is looking great. He's definitely got a completely different personality than he had 2 days ago. I'm really thankful for that.
Roman is ready to bust out of Hotel Hodges and live a good life. He's definitely one of those cases. I'll always remember Roman.
Buddy.
He's good to go, my friend. Pleasure.
All right, thank you.
All right, man. He really is a cool cat. He started to steal our hearts, but you gotta go home. Come here, buddy. Obviously, you have to be an animal lover to work here at Critter Fix.
No, you have to be an animal fanatic to work here at Critter Fix.
From a killer sneaking in all them doggone Fosters.
Till Jordan want to take every animal around here home to her family.
And we cannot forget Andrea's fanatical obsession with Bear.
Nobody comes between Bear and Andrea.
No kidding. It's no joke how much we love our critters here at Critter Fix.
Hi.
Animal rehabber Nicole returns with rescued wolf Draco.
Draco is our black wolf that presented having some difficulty walking, and we diagnosed it with hip dysplasia, as well as Draco has a pellet near the spinal cord, but it's in an area that we really can't do surgery to remove. We're sending home on anti-inflammatory and pain medication.
It's all right, buddy.
Definitely hoping that we're getting around well. Do I expect us to be up, running, and normal? No. But I'm hoping that the medication is enough to have a good quality of life. All right, Draco, what you got going, buddy? Oh, yeah, that's a whole lot better. We're still a little weak back there, but
It's improvement.
That's a huge difference.
I'm amazed. Draco is really moving around real well, and I am pleasantly surprised.
He just looks happier to me overall.
Way happier than initially. When
Me
we were
too.
back here last time, I was very concerned. We were really swayed in the back end, and at that point, I was really thinking it probably gonna not have a good ending.
too.
But I feel good about it now. Overall, I'm feeling fantastic. This went from one of those things where, oh, we're gonna have to put this baby down, to we maintain it and we're doing well. So my hope for Draco is that we continue to improve and be even more mobile and just live a long, 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 happy life. At this point, we're gonna refill the meds, but I only wanna give him as needed.
Okay.
He looks happy. Look at
Yeah,
him.
good deal.
I'm really happy because we're doing really well. Thank you, Dr. Ferguson. Dr. Ferguson's given me a lot of hope of what animals are capable of recovering from. I appreciate him from my heart. He's so cute. That's a good Draco.